attending our today's peer learning, which is called Implementation Without Fear Part 2, Accessing Resources, to help you navigate the often complex entitlement systems to access services for your patients. At the end of this session, we'll share additional resources available to you to support you through our collaborative, as well as a short evaluation that we'd like for you to complete, which includes a gift card. Before we begin, please know that we will be recording this session because it's going to have a lot of valuable information for providers. And I'd like to remind you to please mute your speakers. And also put your name and site in the chat along with any questions that you have for us to address at our Q&A at the end. We are a collaborative of First 5 Alameda and Contra Costa County, UCSF Benioff Children's Hospital Center for Child and Community Health, the Medical Home Project at Stanford Children's Health, and Dr. Renee Wachtel, Developmental and Behavioral Pediatrician and Clinical Professor of Pediatrics at UCSF School of Medicine. I'm Lorene Perret, Program Manager with the Medical Home Project of Stanford Children's Health, where we partner with Help Me Grow of Alameda, Contra Costa, and San Mateo counties, and Child Health and Disability Prevention of Alameda County to promote developmental and trauma screening programs for pediatric providers. We also promote child health and development with linkages to resources throughout the counties to better serve children ages 0 to 5 and those with special healthcare needs. Through our ACEs Aware initiative, our collaborative will offer you many resources curated through us at the Medical Home Project, along with access to services for children and youth with special healthcare needs via our monthly TA and outreach, currently available to you in our twice monthly newsletters. So please use us as an extension to your referral desk for resources for children 0 to 5 and those with special healthcare needs. Today, we have a great panel of resource providers here to support children and families. We'll begin with Dr. Renee Wachtel, who will present a clinical case example using the Pearl Screener. And we also have Dr. Barbara Ivins, Clinical Director, Interim Program Manager of Early Intervention Services, and Co-Project Director, Infancy and Early Childhood Mental Health Consortium with UCSF Benioff Children's Hospital. That was a mouthful. And then we also have Evelyn Hoskins, Associate Director of Federal Programs with the Regional Center of the East Bay. Allison Warner is Mission Valley SELPA Infant Toddler Service Coordinator. And Eileen Crum, Executive Director of Family Resource Navigators. We also have Wendy Diaz, Help Me Grow Care Coordinator of Contra Costa Crisis Center, and Lauda Ortero, Help Me Grow Alameda County Services Program Coordinator. Thanks again to all of our participants. And Dr. Wachtel, why don't you take it away?
Okay, I'm happy to. So first of all, welcome everyone. We're really pleased to have such great panelists and glad that you would take some time from the end of your week on a Friday evening to have us provide you with some resources and ideas of what you can do to help your patients. I thought a good way to get this started would be a patient example. And so I thought I'd use a recent patient. In fact, it was a child I saw just yesterday. So I'm going to tell you a little bit about her. Angelica is a 2-year-old that I saw yesterday, and her mom was concerned about 2 things. One was that she doesn't speak much. In fact, she only has 2 words, and those 2 words are mama and hi. And so I asked how Angelica lets her mom know what she wants. And the mom said, well, sometimes she'll take my hand and bring me over to something. And sometimes she'll point at what she wants. But sometimes she'll just put her hand out. And I have to guess what it is that she wants. So that was the first thing that her mom was concerned about. The second thing she was concerned about, and frankly, she was a lot more concerned about this than the fact that she only had a few words, was that she gets upset and angry very, very easily. And I said, well, when does that happen? And she said, well, it especially happens when she hears loud voices or if she hears crying. And when she hears, especially the crying, she'll cover her ears, she'll start crying and screaming, and she'll start throwing things sometimes, or sometimes hitting out at the other family members. And this was a particularly big problem because there are two other children in the family, an 8-year-old girl and an 8-month-old baby. And as you might imagine, the 8-month-old baby cries a lot. And so that is a big problem. The family is very stressed, the mom says, because there's something she described as a, quote, difficult court situation. And the parents have been separated partly because of domestic violence. So when using the Pearl screen, there were clearly a number of positives. She had an ACEs score of 3, and there were some other issues in addition on the social determinants of health. So what I have posed to the panelists is, would this be an appropriate referral to your program if the child was 2, as the child was that I saw yesterday? Or if supposing she was 4, would this still be an appropriate referral to your program? And if so, how does the referral system work, and what services might the child and family receive? Now, this is obviously a somewhat complicated patient example, but in fact, it's the kind that we see all the time, at least I see all the time. And so I think it would be helpful for the panelists to tell us about how they would approach the situation. So I'd like to call first on Dr. Barbara Ivins so that she can tell us more about the early childhood mental health system. Take it away, Dr. Ivins.
Thank you, Dr. Wachtel, and welcome everybody. Thank you for giving us a case example to chew over as we think about this. So let me answer your first question. Yes, this would be an appropriate referral, not just to my program at Benioff Children's Hospital, but also to the early childhood mental health system of care in Alameda County. Our program at Benioff Children's Hospital, Early Intervention Services, is an umbrella for a variety of treatment and service programs for children with medical, developmental, and psychosocial trauma exposure. And we are considered specialty mental health. So I want to say that in particular because the system, the county health plan system, is designed around thinking about referrals from the perspective of what would stay in a pediatric practice under, say, anticipatory guidance, what would be referred to mild to moderate, and what would be referred to moderate or severe. All of the county mental health funded programs, mental health programs, are considered specialty mental health, so moderate to severe. All of them must be full scope Medi-Cal, meaning no share of cost. So you didn't say anything about their insurance situation, Renee, when you said something about the case. So for instance, if this were a family with private insurance, you would not be able to refer to any of the early childhood county systems, and you would be going through private insurance panels. So that's really important, or private practitioners in the community. All children referred into our system must have behavioral symptoms in addition to developmental concerns. So you mentioned her speech delay at 2 years of age, which we think of as a developmental concern, though we don't know why. So it could in fact be a speech delay that is in part related to something like trauma or development gone awry. So the behavioral concerns about her screaming and also, or her hitting, and also the family circumstances that you described related to difficult separation and potential domestic violence would very much make this a referral that would be appropriate. You should know that there is a requirement, there's a state requirement of a timeliness rule for mental health now. So what this means for you as pediatricians referring to the mental health system is mental health has to respond to the referral if they take it by offering an appointment within 10 days of receiving the referral. So what this means for the community is that if people, there's no longer what amounts to a waiting list. So you can refer, say, to Children's Hospital, and if we don't have clinicians who can take a case, we will not accept the referral. You can try and refer a week later, and if we do have somebody who has an opening, we will accept the referral. So this timeliness rule is affecting some of those doorways, gateways into doing that. So treatment services, in order to take it, the mental health system works by giving you a period of time, 30 days to make a diagnosis. So we would take that referral, we would contact the family, and we would do our own assessment. In my program, that includes both a developmental and a mental health partner who will take a good look at that. But in order to continue beyond the 30 days, we have to have a DSM-5 Axis 1 diagnosis. So if we did not, then we would not be able to continue for treatment. And most of the services in the early childhood mental health world are dyadic, meaning they're relational. Many of them occur in the home. So that family situation that you talked about would very much be something that we would pay attention to. And what I have on the slide here is AlamedaKids.org will give you a list of all of those early childhood mental health programs. And I also wanted people to make sure they knew about the CAP line at Children's Hospital. That's the Child and Adolescent Psychiatry portal. So if you thought there were psychiatric issues as a pediatric provider and you were enrolled with CAP, then you could call and get a phone consultation. So if I can have the next slide, I will show you what we have to fill out. Can you make that a little bigger because people can't see it, but I think you have it as a handout. So what you'll see here is that all of the mental health service programs have to fill this form out. It's meant as an algorithm for you to figure out if this is a good assessment for mental health. And you can see that you have column A and column B. And if you go down to the referral algorithm, you will see how this is designed. And this form was made up by the early childhood mental health community to pretty much ensure that young children of high risk would make it into specialty mental health, meaning they'd make it into seeing a provider who had particular training in early childhood mental health. And so you'll see, we could look at your case, Renee, and check some boxes here in terms of how that would really happen. But you can see that even if a child is 0 to 3, that's one of the criteria for getting a child into specialty mental health. Your second question about whether that child would be appropriate if the child was 4, yes. All of the early childhood mental health contracts with the county are basically for 0 to 8. Most of them want the referrals young, meaning in my program, I want the referral for a child pretty much under age 6. We can stay with them until they're 8. But if a child came into our program as a 7 or 8-year-old, we would likely steer them to a different service program that saw older children. So yes, 2-year-olds, yes, 4-year-olds, yes, a very appropriate referral, both as a combination. And for young children, the service system is a little siloed in terms of what's development, what's mental health, in terms of who pays for services or funds them. But we would see the integration of that as very much central to our service program. So I think that answers your questions. And this, again, this is not a referral form. What's here, it's an algorithm for figuring out if this is a good referral to mental health, specialty mental health.
So Barbara, how would a pediatrician make a referral?
So on the Alameda Kids.org website, there is a phone number for each of those programs. You could either call the Access line, and Access would refer you to a clinician, or you could go to AlamedaKids.org and look at those 14 different service programs, and each one of them has a referral number and a contact person that you could call. So I mention all of them because, again, my Children's Hospital program, we frequently serve the pediatric needs of our community of pediatricians. So our primary care pretty much covers 50 or 60% of the referrals that come into our particular program. But there are many programs in the community who get a lot of referrals, say, from other people on this panel, from Help Me Grow in particular, from the regional center. And all of those programs are really available. Many of them have, I will say this too, my program, we can provide services in English and Spanish and Arabic. And many of the programs have a multilingual, bilingual staff. And also there are interpreter services that are covered by Access. So that allow people to provide services for non-English speaking families too, which is really important. So going to those contact lines, that's why I put the alamedakids.org on there. There isn't, you basically refer program by program, or you call Access, and Access would do something similar.
Thank you. And could you, for those on the call who are not familiar with what an Access 1 disorder is, could you clarify that a little bit?
Yeah, so the DSM is the Diagnostic and Statistical Manual for Mental Health Disorders. It is a multi-axial system. Axis 1 are the clinical diagnosis categories. So you would have to be in one of those. The other axes are related to, say, some of the social determinants and medical conditions and other things like that, but you would have to have a clinical diagnosis. In early childhood, there is one called emotional disorder of infancy or disorder of infancy, NOS. Often we put a lot into that category. We often use adjustment disorder. Sometimes we use anxiety disorder. There is a category for post-traumatic stress disorder. So in the case that you discussed, Renee, we would have to unpack through our assessment how much of what we saw in this behavior we thought was really related to some of the social determinant factors that you kind of identified, or the ACEs factors in the child's life, and that would help us move us in the direction of which diagnostic category we thought that was. But for instance, if you just thought that this was a child, let's say you had a child who was leaning towards an autism spectrum diagnosis or a neurodevelopmental disorder. The neurodevelopmental disorders, even though they are covered in Axis 1, are not included under mental health funding. So that begins to be where there's a differentiation there between some of those developmental kids and some of the kids that present with developmental concerns, but also we need that evidence of behavioral difficulty.
Thank you.
Mm-hmm.
Evelyn, will you tell us a little bit more about how this might work for the regional center of the East Bay and the Early Start programs and other regional center programs? You have to unmute.
Here we go. Okay. She would be an appropriate referral to Early Start because she is under the age of 3, since Early Start is birth to 3. She could be referred through 4 different ways through our referral line to the Intake and Assessment Unit. And that number is 510-618-6195. The referral can come via eFax, which is 510-678-4156. And it would be attention EI intake. It can also be a referral faxed to our referral line, 510-618-7763, attention EI intake. And the referral can also be emailed to earlystartreferrals@rcev.org. There's a universal interagency referral form that's in the community that can be utilized for this purpose. The referral can come from anyone, in the community, but the parent must be in agreement to the referral. And at the time, if someone is discussing the referral to the Early Start program, there is information that would be helpful to the parent to know at the same time that that referral is happening. Because under California law, any child who's determined eligible for Early Start the parents are required to access their medical insurance to find out if there's support for their child through their medical coverage. And if those referrals could happen at the same time, that's going to be very supportive to the family hearing it so that they can begin that process. The intake coordinators will call the parent to gather information. And then if the referral is moved on to an evaluation process where the intake supervisor identifies all of the areas that have been identified as concerns. It's indicated here that she is not speaking, but our evaluations are full developmental evaluations in all domains, because there may be other concerns that the parent is not as aware of. And when we do that, it gives a total snapshot of the child on that date, which things change from day to day. But our evaluations are comprehensive in addressing all of the developmental domains. The evaluations must happen within 45 days of her being referred. And if she is eligible, an IFSP is developed with the parent if they're in agreement within that same 45 calendar days. And once the parent signs the IFSP, there are 45 days that we would be involved in trying to locate supports for her. As part of the intake, the MChat is also one of the screening tools that is used. So that would identify if there are other social, emotional, or behavioral supports or communication concerns that aren't just identified specifically from the parent. And the MChat is utilized for every child who is at least 16 months of age in the intake process to gather information from the parents. Sometimes the medical information may have an MChat in it as well. So that is it's a tool that's being used rather comprehensively throughout the community. So once she's determined eligible and we've got the services identified, we vendor with specialists. We can only fund services that we vendor and contract with. We do not fund generic services. If some of the supports that would be appropriate for her are through her medical insurance, we can assist with copay. And that parent would need to provide us with evidence of coverage and the information related to how those services would be provided. If the medical insurance, an example, if they provided 2 hours of a month for speech therapy for her, and our evaluation determined that she needs 1 hour per week, then we would provide up to 3 hours per month in order to bring her to that level that our evaluation has determined in combination with what the insurance provides. As she moves through early start, in 6 months from the time that she's begun to receive services, there would be a review of the IFSP and the services that are in place. We would get progress reports to see how she's doing and if there needs to be any changes. Since she's 2 years old, she would be with early start up to age 3, unless she makes improvement and is at age level and the parents or the ID team determines that she does not need any more support. Other than that, she would be with early start up to her birth date of whatever it would be, turning 3. During that time, we would also be providing a opportunity for the parents to make a decision close to the age of 3 as to whether they would like for her to be evaluated for ongoing eligibility with the regional center. Regional center services are different from early start services. And in that process, it would be determined whether she has a developmental disability and could become a client ongoing with the regional center for the rest of her life. We also provide the transition from early start to whatever the parents' next steps are for her. Sometimes that is with the school district. Under the IDA supports, we are required to refer every child who is a participant in early start to Part B services through the school districts because those children are potentially eligible for their services. Our eligibility does not determine eligibility for anything except early start. So that referral would be for them to gather information from the parent, and we would also provide reports that the parent has agreed that can be shared, which could give some baseline information as to where she's at as she's preparing to leave from early start. School district does their assessment and determines if she meets their criteria for preschool special education support, and they would identify what those would be. As if the child is determined eligible for ongoing services with the regional center, that evaluation is completed, the determination has happened, and we transfer her case onto an ongoing case manager in our children's division, and she becomes a client of the regional center. She is no longer a client of Early Start. Other services that might be available to her, depending on what they are in Early Start when she was determined eligible, could be occupational therapy, speech therapy, of course, based on what's indicated that she's not talking. She may have concerns for autism. We don't know that yet until that evaluation happens, but if that does happen, ABA supports could be put in place, and those are available through medical insurance as well as through the regional center, but not at the same time. If she has that support through medical insurance, that's the provider. We assist with the copay. If that support is not available through medical insurance, we provide that support up till age 3. There is an annual family program fee that might be applicable depending on the family's income, and that is a category that is established by the state, and those funds are accessed through DDS from the parent to DDS. They don't come to the regional center. This is a process that's been in place for several years now, I believe about 2012. Annual program family fee can be $150, or it could be $200, or it can be $0. That fee does not apply to children who are receiving Medi-Cal benefits. So obtaining the medical health benefit card is a process that is required and should be in the child's records. What you see on the screen is the supporting areas of information that I believe is really important for referral sources to know and to share with parents at the time that there's a discussion being held related to referring to Early Start for eligibility determination. And it's important to delineate it that way, that it is Early Start eligibility determination rather than saying you can get Early Start services. We have to determine if the eligibility, if that child meets the eligibility. And the 33% delay in one of those developmental domains, or having an established risk condition, which that hasn't been shared, that's a case for this child. Or being at risk for a developmental delay based on a combination of medical risk factors. If she was a foster care placement child, it would be important to provide the information about who holds the educational rights for her. That helps to move that eligibility and intake process along. The intake coordinators cannot share information with anyone related to a foster care child unless we know who holds the educational rights and is the decision maker. Current medical records. It's very important if we can get current medical records at the time of referral. I know sometimes that's difficult, but it is a conversation that should be had with the parent. If the referral is coming from a healthcare agency or a healthcare provider, it would be very important at the time that the referral is being discussed with the parent to have them sign a release so those records could come along in a timely manner. Our timelines are really restrictive. We have 45 calendar days that include Saturday and Sundays, and our offices aren't open and functioning in a working capacity on those days. If this referral is not coming from a healthcare provider, that discussion still needs to be had with the parent, because there are releases of information that can be provided through the physician's office or whomever is making the referral to help that parent get the medical records. It's also, there are some criteria which some of you may not have ability to do, or us, because there's a requirement sometimes to have a copy of a person's ID, physical, their actual ID, and that's not something that we would have access to as part of requesting a release of information. I believe also there is now some requirements to have a wet signature from the parent. We're, with the pandemic and everything that's happened with COVID-19, we're trying to access as many parent signatures as we can through DocuSign, and that would not be considered a wet signature, unfortunately, based on the information that we've received. So any way that we can help each other in helping the child and their family move through the referral and the service process of early start, that's what we're all trying to do. I can't think of anything else right now related to the referral. I believe I've touched on all of those things that are really going to be helpful that can be a hindrance. The next slide kind of shows the flow of where a child moves through early start. This document is given to every parent when their child is determined eligible, so they know exactly who their case manager is, their service coordinator. When we're having our initial meeting, that's the first contact for the service coordinator and the parents. Their norm, once they're in eligibility, of familiarity is with that person who is providing the services week to week. That's not the case manager. Case managers' contacts are initially, and then every 6 months, that there's a contact from the parent, unless there's a communication that the parent has initiated or the service coordinator has initiated in between, related to a change in service or a need for an additional service. But routinely, it would be a 6-month contact between case managers and parents. I've kind of gone through how a child would move through in terms of the eligibility happening in 45 days of the referral, services being put in place within 45 days of the parent signing and agreeing to an IFSP. Not every parent agrees to an IFSP. Sometimes they're not ready, or there's parts of the IFSP that they're not open to, and it's fine to not be open to parts of it. Our signature page addresses that if there's specified areas that the parent does not want, they do not have to accept it. We're a voluntary agency, and the supports are voluntary in that they're being offered. There's no mandate that enforces that these supports must be received from a parent for their child. It is their decision. The parent is always the number one decision maker related to their child as far as early start is involved. The 6-month review happens, transition conference happens. It can begin as early as 30 months for a child in early start, and moving forward up until 33 months. We must make that transition happen prior to the child's 3rd birthday, at least 90 days. The referral from Part C to Part B must happen at least 90 days. And this is to allow the school districts an opportunity to do their processes. They have timelines, as we all do. And the ongoing eligibility, if we do not have medical records for ongoing eligibility, that is a real hindrance. That's another time that we need to get the release of information signed to share the current medical records and any evaluations or reports that that child has been involved in as part of that ongoing eligibility determination, which will determine whether she has a developmental disability and will become an ongoing client of the regional center. I believe I've covered as much as I can related to what this child would be receiving through early start. If she's 4 years old, she would be referred to the intake and assessment for age 3 and above, which is directly into the regional center system. It has nothing to do with early start. And they would make the determination as to whether she meets the criteria under the Lanterman Act to become a client of the regional center. And in terms of services, we have an IFSP in early start. Regional centers utilize an IPP. And the IPP is an individual program plan. It is client focused, whereas our IFSP is family focused with their child. And the IPP would identify the supports and measures that would be put in place to support the child as she moves forward into her education process. The supports that Regional Center would provide would be home and community based. We would not support the supports that would be received through education for an ongoing client of the Regional Center. And to refer to the ongoing intake and assessment, that phone line is 510-618-6122. They have a process where they have an intake information packet they mail out to potential applicants into the Regional Center system. Once it's returned, then their timeline starts. And the process for ongoing eligibility can be up to, it's not a set time, but I would say between 120 and 140 days for that whole complete process to be finished. And then she would move on to an ongoing case manager who is in the children's division of the Regional Center. Any questions?
Actually,
Evelyn, that was very helpful. Could you just describe for a child who's over 3, so like this example of a child who's 4, what the eligibility eligibility diagnoses are for ongoing Regional Center services?
Okay, a child who is age 3 and above, the diagnosis could be intellectual disability, a diagnosis of autism, cerebral palsy, and epilepsy that's substantially handicapping. As you all know, we could have those medical conditions and be fully capable of functioning. But to be eligible with Regional Center, those conditions would need to be substantially handicapping. There's a 5th category also where it's not a known disability, but the functioning that incapacitates or an individual must be similar to that of someone who has intellectual disability. And they could become a client of the Regional Center. The goal and mission of the supports would be to help that individual to become as functional as possible and to live their life to the best of their ability throughout life. The supports in the IPP would be based on needs of what that child and the family have, or I would say client, because we're talking about a child, but the client, what their needs are, that's how the IPP is driven, based on needs and the supports that are going to help within the home and the community.
Thank you. There's a question in the chat about what is generic services in relation to the Regional Center. Could you explain?
Medical services, mental health, wraparound services, social services, say a social service agency, say foster care, that would be a generic resource that's not a support that's funded or supported through the Regional Center. Some of the supports that a child may need or an individual may need that are not part of the process of the supports within the Regional Center's realms of being able to provide. So it could be anything out in the community that is not fundable through the Regional Center. And we are payer of last resort. So if there are supports that are available, that's where that support should be attempted to access and determine whether it's available. If it's denied, then it needs to be determined if it meets the denial that would fit for the Regional Center to be able to support. But if it's not a vendor or a category of service that we would support, it would be considered generic resources. And there's many of them out in the community. Say someone who wants to be able to take a dance class. That would be a generic resource.
Okay, thank you very much. That's really very helpful. Why don't we shift? I think this is a good transition to Allison Warner, who's from Fremont Unified School District, who's gonna tell us about that interface between special education and the regional center programs.
Great, thank you so much for having me. Thank you, Dr. Wachtel. So I do work for Fremont Unified School District along with the Mission Valley CELPA. So a CELPA is a special education local planning area that would encompass multiple school districts. So my CELPA is Fremont and Union City and Newark. So we would serve families birth to 5 who reside in one of those 3 school districts. So today I'll try to speak in general though to the birth to 5 referral process in terms of special education. And just as the regional center kind of handles their birth to 3 referrals differently than their 3 and up, so does the school district. So from birth to 3, the CELPA actually does serve children who have an identified solely low incidence disability. So a solely low incidence disability would be a child who has a confirmed hearing loss or visual impairment or deaf blindness or an orthopedic impairment. So the child from Dr. Wachtel's case study would not be an appropriate referral to our early start program. But as Ms. Hoskins kind of indicated, that would be an appropriate referral to the regional center of the East Bay or wherever the family resides. And the regional center and the local school districts do work very collaboratively to ensure a smooth and seamless transition. So we would work with the regional center to ensure that sometime between 30 months and before the child's 3rd birthday, that we would determine if this child was eligible for an IEP. So I can kind of speak to, would it be an appropriate referral if the child was 4 years old? And yes, most definitely for a 4-year-old, that would be an appropriate referral to special education. In general, there's not one place where you would send your referrals for special education. So essentially it's up to the provider or the parent to do a search for what their home school district is and then determine the special education's contact information. Okay, so there's not just one place where you would send it. You have to look at where the child resides and then go from there. So referrals to preschool education, again, are for children from ages 3 to 5 who are demonstrating delays or have a medical diagnosis resulting in a delay in the areas of cognitive, adaptive, motor, language, or social emotional development. And it's important to also note that simply because a child might have a medical diagnosis, that in and of itself doesn't necessarily indicate that the child would be eligible, but would definitely be an appropriate referral to special education from the ranges of 3 to 5 years. So in terms of the timeline, once a family or a provider reaches out to ask for a special education assessment, the school district has 15 calendar days to contact the family and offer what we call an assessment plan. And our duty is to assess in all areas of suspected need or disability. And then once the parent consents to the assessment plan, we can't complete any assessments without parent consent, but at that point, the district would then have 60 calendar days to assess and hold an individualized education program or IEP meeting to determine the child's eligibility for special education. So speaking specifically to eligibility, in special education, there's 13 different eligibility categories that are recognized by IDEA and the California Department of Education. So in order for a child to qualify, a child must meet the specific educational criteria for at least one of these categories. So I have the categories listed. I'm not sure if you can see them. It's a little bit small, but the 13 categories are autism, deaf blindness, deafness, emotional disturbance, hard of hearing, intellectual disability, multiple disabilities, orthopedic impairment, other health impaired, specific learning disability, language or speech impairment, traumatic brain injury, and visual impairment. So each eligibility category, again, has a specific educational criteria that might vary slightly from maybe what you would think the medical criteria is for one of those disabilities. So we're looking at the educational criteria. And then it's also important to note that when we're looking at special education eligibility, we're looking at two components. So one, the child, again, must present with one of the 13 disabling conditions, but also this condition or disability must have an adverse effect on the child's education. So without that second component that's resulting in that impact to educational progress or access, then the child wouldn't be eligible for special education. So once the assessments are completed and an IEP meeting can be held, if the child is found eligible, supports and services are discussed at the IEP meeting. They can be direct services to the student. They can also be a consultation model to their current, if they're in a preschool program already, we could provide consultative services. And then the IEP team must also consider what we call a least restrictive environment, or LRE. And so we want to make sure that to the maximum extent possible that the IEP team is ensuring that the child has access to typically developing peers. And so that's just a really key component of the IEP. So once the child's found eligible for an IEP, the IEP is written for a 1-year time frame, and it's reviewed annually and then also triennially. So the annual IEP is just looking at the child's overall progress on the goals and determining the appropriate goals moving forward in services. And then triennially, the eligibility for the IEP is reviewed with more formal and standardized assessments. And at any time, if the child were to make substantial progress, they could be assessed and exited from special education. Again, all these services fall under what we call a free and appropriate public education, and so they're free services to families. I think that covers just about everything. Are there any questions that the team has?
Yeah, I think we'll hold the questions to the end when
Okay.
we can all chat about the different things
Okay.
that we have questions
Okay.
about, if that's okay.
Okay.
So, our next speaker is Eileen Krem from Family Resource Navigators, who's going to tell us about navigation. And we're not talking about ships.
It might feel like a ship, but it's not a ship. So hi, I'm Eileen. I'm the director of FRN, and we are a group of 25 family members. And if you can move to the next slide, please. We are a family-driven and family-centered agency. We are multicultural and multilingual. I think we have 10 languages right now. Sometimes we've gone up to almost 18, but 10's about our minimum. So we have Arabic, Cantonese, English, French, Hindu, Mam, Mandarin, Spanish, and Urdu, Tamil, and I think that's it for right now. So we are family members who are trained to help other family members. We consider ourselves an education service for families and education and empower them. So what we're really trying to do is give them the knowledge we have as perhaps more experienced or further down the line, to help them to understand where they need to go in all these services, because as we've heard, these services are very, very complex to navigate. Can I have the next slide, please? Great. So this talks about what we can do at FRN and the services we provide, and these are also all free for families. We do family navigation, and Laura Otera is going to talk about Help Me Grow, so I'll just touch upon that. We do the family navigation for Help Me Grow, though there are also people who work off the phone who do very similar jobs to what we're doing. We do a lot of trainings for families to help them understand these systems. As you can imagine, IPP, IEP, FAPE, and LRE, these are hard things for families to grasp. So we are always trying to help them understand, to educate them, because for families, they're going to be the first and best advocate for the family. We want them to feel empowered to do that. And so we're really that kind of support. We're the coach, the mentor, the cheerleader, right, for all these families. We give them information. I might not always agree with what some of the systems represent their rules. So we try to give them information from the parent perspective as well as the district perspective. We also have leadership for parents. We have trainings for them to be able to sit on committees, to take place in the different grassroots movement here in the county or at the state. To teach them how to work with the bureaucracy to change policy, because we're helping them with advocacy, the little a with their kids, connectivity with a big C, because we make sure that they get there, and advocacy with a big A for people who want to change the system. And we have trained over 300 family members to become leaders in the community. We do a lot of these kinds of parent professional collaborations. We also do clinics for IEPs. I would say IEPs are the most confusing thing for families. We also have support groups and play groups that are ongoing, most of which right now are virtual. The next slide, please. And one of the things we started about 3 years ago that I think are really important to families are community gatherings and events. It's very easy for family members to become isolated, to not feel like they have anybody in the community that they can talk to. So FRN has some big events, usually 6 to 8 a year now, that are targeted toward different communities. So these are pictures from our Holy event of 2 years ago, pre-COVID, when we could actually stand next to people without masks on, and our Christmas party from a few years ago for our Spanish-speaking family members. We are trying to continue these. Right now we have a Bollywood dancing ongoing. We have a Mother's Day event coming up where we're doing some crafts with the kids online so that they can make something for their parents, while we're doing some self-care things with the parents for celebration of Mother's Day. So we're trying to keep these things going because community is one of the really important things that people need because they feel very isolated. So that's one of the things we could offer that family, connection with other people, right? And that's a really important source of strength to them. Next slide, please. So just an idea, last year we served over 1,200 families in family navigation. That means intensive up to 6 or 8 months of working with the family multiple times. Sometimes it's only 6 or 8 times, but it more frequently is 25, 30, 35 times that we're working with the family, connecting with them, checking in to say, hey, I know you got the thing for the regional center. Have they called you back, right? Or did we get the birth certificate you need, you know, or whatever it happens to be, helping them to follow up, helping them to get connected. And so we serve families 0 to 21. We are trying to make sure we can serve everybody. We can't serve everybody as intensively because we don't get funding for everybody, but we do what we can. We connect the families to services. We already talked about the empowerment aspect of what we're doing. And we help the families build that community of mutual support. And it's very important to us as we do all this work to make sure we're doing it at a high quality and we're checking in from the families to make sure we're doing what helps them, what they want, and they're satisfied with what we do. Next slide, please. Oh, back one. Did we skip one? Yes, thank you. So these were the referrals that we did in 2019, 2020. We did over 800 to the regional center of a variety of types, both for the under 3 and for the over 3, as well as for people who were not satisfied with their services and wanted to appeal it or wanted some kind of change. We helped about 600 families in the school districts. We attended 337 IEPs. I don't know what the count is for this year via COVID, whether it would be more or less. We help families with insurance and Medi-Cal funded therapies, as you heard. For regional center, as the payer of last resort, kids have to first access their insurance, so we help with that. We did some referrals to mental health. We also do referrals to childcare, recreation, and enrichment. And in the last couple of years, we've really started to push on helping families with basic needs as well. Excuse me, Bart is about to go by. So we've done some work with CalFresh and other basic needs. We actually have a small grant from the food bank to explicitly work with families of kids with disabilities. We also help with in-home health supported services. That's a huge support for family members who need someone to take care of their child or want to be able to get some funding to do that themselves. We also help with SSI. So these were the ones that we were successfully connecting just in the last year in those 1,200 families. So the next slide, please. And as I said, we really try to make sure that we do this well. So about 95% of the families felt that our staff were culturally competent and respectful. That's why we have so many different people who speak different languages or from different places, so that we can represent for Alameda County and that people can connect with somebody who understands their culture. 95% also said that they feel they are stronger advocates for their children, and 92% said that they're more knowledgeable about systems. I always find that interesting, that the numbers for understanding the complexities of these systems are lower than people's confidence in advocating, but it also tells you how difficult it is for families to do this. So this is what we do. We are family members helping the families to figure out where to connect to build community with other people. And we help with a whole myriad of services. We are free. So can any 2-year-old or 4-year-old, the parents of a 2-year-old or 4-year-old, be referred to us? Of course, right? Do we provide the kind of direct services that we've heard of already? No, what we provide is the family support in understanding how to connect, right? And how to advocate for the things that their kids need, as well as things that their family might need, like CalFresh. I think there's one more slide. Are we at the end? Yes. So the last thing we do is family leadership. And as I spoke a little bit about, we've trained over 300 family members in the last 8 years to be leaders in the community. So this was 2 years ago. This was our Spanish-speaking family leadership group who completed 7 weeks of leadership training. And then what we do with these family leaders, and our next slide, please, is when we have an opening, we hire them. So these are both people who have come from the community, who are strong advocates to their children. And when we got to know them and we had openings, or we got the additional funding to be able to support more staff, we hired people, thus increasing our language capacity, our cultural capacity, and creating job development. So some people stay with us for a couple of years, some people stay with us for a lot of years, but FRN is a place where family members, either as stipended volunteers or as staff members, can return to the workforce. And for those of us with kids with significant developmental disabilities, that can be a really hard process. So this is something we're really proud of. So the 2 people in this picture have both gone on, one to start her own firm, which is really exciting, and the other to return to advocacy in the community. So all really important things. So we're really proud of what we do. We help about 2,500 families a year. And as I said, about 1,200 in that kind of intensive relationship. And we make a lot of differences because people come out of our services feeling like they can do it for themselves. And that's our aim. So in terms of your questions, yes, we could help them in either case. If they didn't live in Alameda County, we would send them to our friends at Care Parent Network in Contra Costa, right, which does some great work there, and whom we have a close relationship with. And the services they would receive would be learning about the systems, figuring out how to navigate, becoming more confident as advocates, and if they want, becoming leaders in the community. So that's
Thank you so much, Eileen. That was great. And it is something to be proud of. I
Thank you.
think that was a great transition to Wendy Diaz, who's going to tell us about Help Me Grow in Contra Costa County, which is obviously one of the partners that you use.
Mhm.
Hi, everybody. So I'm Wendy Diaz. I'm the Help Me Grow Care Coordinator for Contra Costa County. And I'm also based in the Contra Costa Crisis Center. So I'll start off with talking a little bit about Help Me Grow. So what exactly is Help Me Grow? It's a system of early identification that supports a community in identifying children at risk of behavioral or developmental delays as early as possible. But it's not just about delays or behavioral issues, it's also for basic needs as well. So Help Me Grow offers support to ensure that children and parents are connected to the right resources by determining their eligibility, any requirements, things like that. We support a community-based pediatricians, but we also receive referrals from other providers in the community, or parents themselves may request Help Me Grow. The support is provided through educating and motivating providers to conduct systematic surveillance and screening of young children, which is why we encourage a lot of providers to use ASQs. We also serve as a care coordination arm for busy pediatric primary care practices. A lot of the times physicians may not be well versed in things about the development, more health concerns, and they don't know sometimes the resources that are out there. So with Help Me Grow, we help support them and the families. Next slide. Oh, sorry. Let me talk a little louder. So with the case that was brought up earlier, we definitely can help support the child as a 2-year-old and a 4-year-old. With my database, it's the similar one as somebody calling 211 or the crisis lines. And from there, we can usually see what they're eligible for and determine what kind of resources they should be given. We determine a lot of that with their ASQ scores. With the 2-year-old, usually when we look at the information that's given from the referral and from when we talk to the parent, if for communication, it would be like regional center, like Evelyn mentioned. And when they're over 3, we usually refer them to the school districts of where they're located. A lot of other resources are also based on location. And as we continue to build rapport with the parent, that's when we can determine what other resources they may need, like first 5 play groups. Maybe they need parenting classes from co-parent support, things like that. And how to get connected to Help Me Grow, there's different ways. Usually you can refer by sending a fax to us at that number right there. Also, the family can call 211 and be connected to me directly. Usually when we get referrals from 211, they might have heard it from a friend. Maybe somebody mentioned it in passing, things like that. And then we determine what kind of referrals they should be given, what they might be looking for. And sometimes they mention something they didn't know that was out there, like food pantries. A lot of families during this pandemic were also looking for resources for rent assistance, things like that. And then we also offer follow-up contacts, feedback loops to the referring provider. So a lot of the care coordination for families that we use the most is regional center, school districts, mental and behavioral health, and that's also determined by their location. If they're in the West County, it's early childhood mental health. If it's Central, it's We Care. And if it's East Bay, it's the Lynn Center. But with a lot of those things, one of the biggest factors is if they have Medi-Cal or not. Usually when they have commercialized insurance, it can be a little bit tricky, but we continue to support the family to find what's out there for them and what they may be eligible for. And we also have follow-up calls with the families, however much they determine. Sometimes it's once a month. Sometimes they want me to contact them every 3 months or every other month. We're just there to help support them. And it's not just the child that may need help. It could be the whole family. Like how this child that you mentioned has an 8-year-old and a 8-month-old sibling. We can help them get connected to resources as well. But our main client would be the child that's under 5. That is one of the requirements is the child does have to be under the age of 5. However, as they turn 6, we kind of help transition them out, either finding them another program, keeping them a little bit longer if they just need a little extra hand to try to get connected to resources. And we're also 24/7 since we're with the crisis center. Even if they can't get a hold of me right then and there, we have trained call specialists at the crisis center who can help coordinate them with resources as well. So if a parent only works at night, there's always someone here to pick up the phone and to help them get connected to resources and give them information. And we also use the language line, which offers over 240 languages. Even though I am bilingual in Spanish and English, I help parents who have maybe they speak Portuguese, Vietnamese, Nepali, whatever's in the language line, we use to help translate all the information that they may need. And like I mentioned, the ASQ is really important for us to figure out what kind of resources would be better for them. And we also offer them screening as well. If maybe they were just having a bad day during the screening or if they think there's been progress. And usually families get referred to Help Me Grow when there's a development or behavior issue, social emotional development, special health care needs, if they're on a wait list for another resource and just need something in the meantime. And then parent education and support is another big one. And then on the next slide, it's how the referral form looks. So usually from a pediatrician or others, we get the fax referral form, and it can be faxed directly to me. But there's also the helpmegrowcoco.org website. And in the top right corner, where it says free support, there's 2 sections. It's an online referral form from a provider and from a parent. So a parent can directly connect with me, letting me know in the notes exactly what they may need, and the provider as well if maybe the parent is too anxious or doesn't know how to get connected online. And of course, there's also 211, and they can just directly ask for Help Me Grow or Wendy Diaz, and they'll be transferred to me right away. And there's no time limit with working with the family. I'm there however long they need me, and until they reach the age limit, and then trying to find them resources that can help them after that.
Thank you, Wendy. That was very helpful. I'm also amazed that there could be 240 languages that might need support.
Yeah, there's a lot of languages that I haven't even heard of yet, and now I know them.
Very, very amazing. Well, so our last speaker is Laura Otero, who's going to tell us about Help Me Grow from Alameda County. I assume that if someone calls the wrong Help Me Grow, they will get referred to the right Help Me Grow. But take it away, Laura.
Thank you. Hi, everyone. Good evening. Nice to be with all of you and be able to share a little bit about our Help Me Grow. In Alameda County, the Help Me Grow is going to sound somehow similar to our partner in Contra Costa, since it's a national model, but they all are doing, different things or things in a different way. So for us, we also are a coordinated system to support and promote the development, learning, and the social emotional health of the kids in our county. It's for kids 0 to 5 or not enrolled in kindergarten. And we are here for you, pediatricians, for healthcare providers, for families, early care and educations, and really any other provider. And our centralized access point, which you guys know very well as our Help Me Grow phone line, it's here to support all of the providers and the families to provide not only information, but to connect families with different community services. Next slide, please. So for us, we, compared to Contra Costa, we are not with our 211 agency here in Alameda County. We have our own phone line where families and providers can call if they have any questions, any concerns, or really just the need to explore any kind of resources in our community. We have a team of child development care coordinators. They all are bilingual, some in Spanish, some in Cantonese and Mandarin. And also we access, as Wendy mentioned, an interpretation line that way we can support families in any language, since, as you guys know, our county is also pretty diverse. Our staff is also multicultural. And through our Help Me Grow Central Access Point, we can provide families developmental coordination, developmental and anticipatory guidance. And also, even though we are not a case management model, the purpose of the care coordination that our care coordinators provide is with the intention of making sure that we support families to connect with the services, to make sure that eligibility is established, that evaluations happen and the services are in place. Of course, as long as the family needs us and allows us to be with them, supporting them along the way. We coordinate and partner with a lot of the agencies that previously already shared with us, and that allows us to support those kind of referrals. Our care coordinators can provide information on these type of services that the families are in need, or services that the care coordinators think that could benefit any specific family and child. And of course, we have a contract with our family navigators, or with Eileen and her team. And also through the central access point or the phone line, we offer families family navigation support. Our family navigators, as Eileen already shared, the kind of supports that they provide. We have a very seamless, coordinated system where our care coordinators, they always do the initial interview with families. They explore any concerns, any questions that the families might have, or any concerns that you as providers might have. And then together they make any plans for the next steps, for what kind of referrals they are going to be accessing. Sometimes it's referrals with our early intervention with regional center, with the school district. Sometimes our supports in the community, like play groups, and sometimes our supports to support the social, emotional, and mental health of the families and of the kids. So whatever it is, when families accept family navigation, our care coordinators would assign that case to family navigation. All this happens behind, scenes, and for the families, they just know that, another team member will continue providing the support. We share the same database, so it's seamless. Everything about the family, all the information is there, and we work closely, the care coordinators and the family navigators, to ensure that the families receive, the same kind of support. We have the same protocols, and connect to very similar services. The difference, I would say, between, the care coordinators provide all the support over the phone, and with our family navigators, of course, pre-COVID, they would be able to meet with families face to face. And most importantly, our family navigators would be able to provide that peer-to-peer support that Eileen already shared with us. Next slide, please. So really, how and who should you refer? We have our Help Me Grow referral form. It's pretty much what Wendy already showed. And yes, to the to the comment, Dr. Wachtel, yes, so there are occasionally some pediatricians fax the form to us, but we can see that the family resides in Contra Costa. So Contra Costa and I also, and as we also have these agreements and have this nice coordination of, we would send them those referrals forms to them, and they would call the families and vice versa. So that's really nice, collaboration going on. But really, we are pretty flexible. Providers can, can fax the referral form. To be honest, a lot of pediatricians, sometimes they just fax some of the what is it called, the summary sheet of the visit, and they have a way now with the electronic records, they have a way to also let us know what are their concerns, and a little bit about, the family or what they're looking for us to support. Or also sometimes, there are for some families, they provide a postcard or then where it has our information, the number, and they can call our 800 number. And we as well are committed to provide feedback to any referring provider, and to as long as the family agrees to that, and also, of course, especially to the pediatricians, we provide feedback and coordinate and collaborate and let them know what's going on with the family, what are kind of the supports that they are being supported with, and things like that. And for us, in any family can call us, like I said, with any questions, any concerns about their child's development, but also about any other resources or services in the community that they are wondering or in need of. We, of course, appreciate the ASQ. A lot of our pediatricians that we partner with, they do screening and they provide the ASQ, but also, we can, there are times where that is not possible, or where we support that piece, and that's absolutely okay. As long as the family lives in our county, is interested in our services or support, anybody can refer to the family. Next slide, please. And these are just some of the supports and services. I think Wendy already mentioned many of them are very similar. And just, while I have this slide, just an answer to your question, Dr. Wachtel, is yes, this child that you saw yesterday would absolutely be a great referral for us. In this case, a lot of the work that the care coordinators do is, like in this case, I imagine in there, like it could be that the pediatrician refers, and our referral form has has a space for the ACEs score, or in the comment sections, often the pediatricians or referring providers, they share with us some of these things going on, like, this domestic violence, this situation that this family is going through. So our care coordinators will explore always with the families, not just the developmental piece, but also, like, in this case, how is the family doing? Do they have enough, or the resources that they need in terms of, do they have food? Are they connected with any of these services? Also, sometimes in these situations, like, is mom safe? Is she in a place where she feels safe? Perhaps we can support her to explore any shelters. There are situations when, families or mom is just kind of, for now, with this friend, or even, in their car. And so we can provide that kind of support. Often, we explore that because the care coordinator will explore the piece, the developmental piece, like, what is the child, how is the child doing in terms of their communication. There are some concerns. We, of course, want to explore that and connect them to early intervention, or any other support that is going to provide and benefit the child in terms of their language development. But sometimes, the families, of course, in this situation might be more interested in these other resources that has to do with their basic needs. And also, we want to explore, like, any kind of early childhood mental health support for the child. And of course, this is going to look different depending on the insurance of this child. But we want to make sure that that we explore that we provide that support. But also in this case, we want to make sure how mom is doing, and if we need to also provide some information and research for mom. Maybe mom might have also insurance. We want to, of course, make sure that mom is communicating with their physician, but also we want to make sure that mom knows that there are resources for her to get her own mental health support, whether it's through their insurance or other kind of free or resources available. And also some kind of domestic violence support groups or parenting groups. So we want to make sure that we want to cover all those kind of areas. So whether this child is 2 or 4, I think this would be definitely a good referral for Help Me Grow.
Great, thank you very much. So just to pull this all together, what I gather from everyone's presentation is that the child and family that I saw yesterday would benefit from referrals for early childhood mental health. And if the child was under 3, to the Early Start program, which she was 2, and that if she needed help with these referrals or with accessing the services, that both Help Me Grow, depending on where she lived in Contra Costa or Alameda County, or Family Resource Navigators, FRN, could assist with helping her get the services that she needs for this particular child that I saw and the family. And that if the child was 4 years old, that it might or might not be an appropriate referral for the regional center's over 3 program, but it still could be an appropriate referral for early childhood mental health and for potentially the special education through the school system. And that either Help Me Grow or Family Resource Navigators who works with Help Me Grow would be able to assist the family with these referrals and making sure that they didn't hit any roadblocks or barriers in the process. So I'd like to thank everyone for really helping myself and others in the community who winds up getting faced with these complicated situations on a regular basis. And so Lorene has put up some examples of how to access some of these resources, such as the Medical Home Project, the Help Me Grows in both Alameda and Contra Costa County. And just to know that there are some easy to access handouts that you can give to families or websites that you can give to families, both to know for free parenting support information, the whattoexpect.com. One good example of the parent handout is Losing Your Cool with Your Toddler. Familypaths.org has some really great parenting, positive parenting, and other online classes that we can refer our families to. And the Parenting Stress Hotline is available both in English and Spanish, and is another good resource to have. So I want to thank all of the panelists who've really been helping a complicated but resource-rich Bay Area community to access services for 0 to 5. And Lorene, do you want to come on and tell people about the survey and
Absolutely.
thank you gifts for doing the survey?
Sure. So again, I put the information in the chat for the survey. So please fill out the evaluation and you'll definitely get coffee on us. We definitely appreciate that. And it also informs us with the Medical Home Project and Help Me Grow on how we can do better, with providing resources to providers so that providers can better serve children and families. I'd also just like to say thank you to all of you who participated, and I'm hoping that this panel shared a wealth of resources. And I know even if I just heard it, it can still be quite dizzying. But one thing that I do want to underscore is that couple things. You can always call Help Me Grow directly for the kids 0 to 5 and have access to all of these resources. Secondly, here with the Medical Home Project, we actually offer case consultation. It can help walk providers through this process as well. Because as Eileen mentioned, I worked with family resource navigators for many years, and I'm one of those peer parents as well. And so is our team members here at the Medical Home Project, Julie Katz and Patrice Paul. In addition to that, I just want to share that please be on the lookout for our upcoming ASQ and MCHAT trainings that are happening on May 20th for Contra Costa County Help Me Grow partners, and on May 27th for Alameda County Help Me Grow partners. And that's where we'll also be providing referral pathways and give you more detailed information about services like the Regional Center and Family Resource Navigators, and of course, Help Me Grow. So definitely be on the lookout for that, and please reach out to us if you're interested in attending. Again, it's on May 20th and May 27th from 8 to 9 a.m. And then our next peer learning, which is the final in this series for Aces of Where, is going to be happening on June 4th with Beverly Kyer, who will be addressing compassion fatigue and how to create resilient providers. So please stay tuned, and thank you so much for joining us. And let me look at the chat really quickly before we head out. Okay, there is the phone line there for Lauda, and
Yes.
yeah, 510-888-1211.
No, it's just changed. It's our number is actually 888-510-1211.
Oh, it's switched.
It's
Sorry
an
about
800
that.
number. Yeah,
Yeah,
no,
it's an 800 number. Okay.
Yeah.
Well, the other thing is a lot of this information is on all of the handouts. So you have that with the provider referral forms for both regional, for both family, not family resource navigators, but for Help Me Grow for both counties. So all of that information is actually there. And then FRN's number is 547-7322, area code 510. And again, staff are answering, and, that's, we're also available to help support you in navigating to those resources as well. So thanks again, everyone, and we will see you all next time. Please don't forget to fill out the evaluation, and we hope this was valuable. Take care.
Thank you.
Bye. Thanks,
Bye.
everyone.
Thank you.